Senators. My name is Shahab. You want me to spell that as well? S-H-A-H-A-B. And the last name is Abdesalam. A-B-D-E-S-S-A-L-A-M. I am a pediatric surgeon up at Children's Omaha and Children's Hospital up here in Omaha. I am board certified in general surgery, surgical oncology, surgical critical care, and pediatric surgery. When my wife first became pregnant was during my general surgery residency towards the end of that, and she came to me with the proposition that she wanted to have a home birth. It was still legal in the state of Nebraska at that time, and naturally, being a surgeon, I am inherently a skeptical person, as well as one that questions everything. So, having been immersed in a hospital situation and that being really all I had ever seen, I didn't even know that that was even a possibility. So, of course, I said, "You're crazy," and she said, "Well, why don't we just go talk with the midwife and see what she has to say?" So I went there with guns blazing, ready to just shoot her down and say, "There's no way we're going to do this. We're going to have this in the hospital." And at our first visit, she said something which has stuck with me all along, and she said that pregnancy is not a disease, so it doesn't need to be in the hospital. And that inherently made a lot of sense to me in most circumstances. Obviously, a high-risk mother, high-risk baby, of course, they have to be in the hospital. I deal with that every single day. I deal with babies that are on, the tiniest of babies, and of course they have to be in the hospital. But for a healthy mother, healthy baby, uncomplicated pregnancy, it is truly not a disease. It does not belong in a hospital. So that made a lot of sense to me. So since then, I have 5 children. We've had 5 wonderful separate midwives at each one of those births, and they've all been born at home. They're all healthy. They're all wonderful. And the bond and the relationship and the fact that I was able to participate in the deliveries of all my babies was very, very special. The relationships that the midwives develop with the families is unique outside of medicine. It is truly a very tight-knit relationship. They see their patients, I believe, more frequently. They have lower volumes of patients, so they're able to spend more time and really get to know the individual circumstances and make sure that the delivery is as safe as possible. Notes. I want to make sure I wasn't forgetting anything. So that's basically my story. So I've had all 5 of my children at home with an attended midwife, and obviously I have a lot of training myself. I could have potentially done it myself, but the value of their knowledge and their expertise and their training way far exceeded anything that I could have accomplished at this point. So having them as a tool and those resources, invaluable. Obviously, whenever we approach anything in medicine, we approach it as a risk-benefit ratio. So when you look at healthy mothers, healthy babies, and the home environment, your risks are unbelievably low, and there's no reason to introduce excessive risk by bringing them into a hospital situation. I think there's a potential for bad outcomes, and I've seen bad outcomes both in the hospital and heard about things at home. Obviously, mine was not that way. But I don't think we should punish these midwives from keeping them from an environment where it is safe. And again, I just want to highlight that pregnancy in most cases is not a disease. I think it's happening. I've partaken in it. The best way to keep track of it, make sure that it is maintaining its safety profile, is to make sure that we can legalize it and regulate it. Thank you.
Senator Christ? All your children were born in Nebraska?
No, that's not. 3 have been born in Nebraska, 2 are in Ohio.
Okay.
That was in different areas of training.
I'm not trying to pin you down or incarcerate you, but as I understood, in Nebraska, we couldn't have a midwife attending at home. So is it because you were there as a physician that they were, or was it somebody from outside?
No, even as a physician, I am not allowed to attend a home birth. So, back in the 90s when my first child, it was my understanding it was still legal back then. Obviously in Ohio it is legal, and great experience there. My last 2, which were here in Nebraska, yes, they were attended, but it got to be kind of hush-hush.
Yeah, got it. So, given that experience...
And obviously I wouldn't disclose any names.
No, absolutely not. No, that's not about this. What I'm trying to do, though, is you're probably one of the most qualified people to have attended a home birth with a midwife that we maybe will see today. So, maybe we'll see today. But point being, if you could design it, would you say that they would always have to be in conjunction with a care plan that would include a pediatrician or an OB, or that they would work in concert with
Yes,
that?
absolutely. I think that's a valuable relationship that the midwives develop with a backup physician of some sort, whether it's a family practitioner who also does deliveries, whether it's just a straight obstetrician or even a pediatrician potentially. That's a valuable adjunct.
So we did a lot of work last year and a lot of prep with 599, which I think is monumental. And in that, I learned so much about how just a small vitamin or folic acid or whatever it would be during the pregnancy. Does that kind of treatment happen also with midwifery? And
the thoroughness of which they cover the entire health of the mother, obviously in conjunction with the baby, but mostly looking after the mother, far exceeded anything that I had seen in the hospital during my training. Obviously, I went through OB-GYN, I went, delivered babies in the hospital. I saw those relationships and compared it to my own, and top notch. I mean, just really, really. And I've had 5 different midwives. Just because of the environments that we were in and the spacing out of the children, but every one of them exactly the same. I mean, it just was really incredible to see the similarities amongst them.
Last question, and if you don't want to answer it, that's fine, but we have the 407 process that Senator Glore talked about earlier. I don't know if you...
I'm sorry, I arrived late.
Okay. Are you familiar with the 407 process?
I am not. What is that?
Okay, essentially, just to make it short, it is a process whereby if you wanted to increase the scope of someone's practice in any way, and it wasn't currently part of the scope of practice, you would meet this board and discuss whether... And it's really, I think after Senator Glore's tweaks last year, and this committee sending things forward, it's a much better process. Do we need to do a 407 scope of practice in order to get there? Do you feel like the certification of the midwives that you've come in contact with or that are out here are capable of moving forward without that 407 process?
The ones I have come into contact with, and even beyond my 5, I've obviously met quite a few other ones. I don't know that extension is necessary.
Okay. Thank you, Doctor.
Thank you.
Any other questions?